Good afternoon, and thank you for joining us here in the Clarendon Room. Carol Rose is a clinical aromatherapist and educator. She specialises in helping people with progressive and life-limiting conditions. Carol educates healthcare professionals from many disciplines on issues relating to aromatherapy in oncology and palliative care, and she is the lead therapist at her local hospice. Carol is also a regular contributor to the International Journal of Clinical Aromatherapy. We are delighted to welcome Carol today to talk about making a difference in cancer care with the potential of aromatherapy. If you do have any questions, please post them in the Q&A box and Carol will try to answer them at the end of her presentation if time allows. Thank you. Okay, Carol.
Okay. Well, hello, everybody. It really is wonderful to be connected with all of you. And my sincere thanks to Leukaemia and Blood Cancer New Zealand, not only for putting on such an interesting program this year, but being able to put on a program at all and for us to connect. And I know that there's been a huge amount of behind the scenes work that that has gone on, and I'm just immensely grateful to everybody for that. So it has meant that I've had to do a bit of a crash course in Zoom. So I'm going to put those skills to the test. And the first thing I'm just going to start with is sharing the screen. So if you just bear with me for a moment. Oops. There we go. And you should be seeing the first slide now. Hopefully everybody can see that now. So it really is an immense privilege to be connecting, particularly with so many people that have experience in cancer and personal connections with someone with cancer, either a blood cancer or a blood disorder. It's an area that's familiar to me from the point of view of me being an oncology and palliative care nurse for a lot of my working life. That journey started over 30 years ago when I was a young registered nurse working at the Royal Marsden Cancer Hospital in London. And that's where I first discovered aromatherapy. I was specializing in oncology and these beautiful aromas wafted down the corridors and I just followed them. And it opened up a whole new world for me. Now, at that time, they were using essential oils to help patients get back to sleep. And for me, sleep and hospitals were poles apart. So I watched these beautiful oils being mixed and administered with beautiful massages to the hands or the feet. But what really struck the chord was hearing what patients had to say, telling me how they'd been able to get off to sleep more easily, how they had overall had a better quality of sleep. And that certainly triggered something and set me off on a journey to find out more about this aromatherapy. It's been a fantastic time since then. I've worked with some amazing educators and people around the globe and eventually qualified as an aromatherapist. So I was able to then merge all of my loves and passions, my experience and skills. And I now specialize, as Deborah said, in people with chronic, progressive and life-limiting illness. Excuse me. Now, 2 years ago, I had the great privilege of being invited back to the Royal Marsden as a speaker. It was quite a surreal experience going back after 30 years, but it was to a seminar that was the first of its kind really in the world because it was looking at the advances of clinical aromatherapy within healthcare. And it was quite overwhelming how far things have come and to be a part of that as well. So I'd like to share some of that with you today and talk about how we can make a difference in cancer care with aromatherapy and optimize someone's quality of life. Now, some of you already may be using aromatherapy. Some of you may be interested in it, thinking about it. Some of you may be even skeptical. That's absolutely fine. But I do need to put us all on the same page. So we're going to start the session today looking at what an essential oil is, how we extract those beautiful oils from the aromatic plant material, how we determine what an oil's therapeutic activities are, its actions are on the body. Then we'll take a look at the difference between holistic and clinical aromatherapy, and then how we can integrate that into supportive approaches to optimize the quality of life of someone with cancer. So when we think of aromatherapy, generally we're thinking about essential oils, these funny little bottles, these amber glass bottles that you may see in the pharmacies or the healthcare shops, but they've got a power pack aroma. And these are essential oils. Now, an essential oil is a complex, concentrated chemical cocktail. Essential oils come from most aromatic plants, but not all. And it depends on the plant as to where we actually extract that oil from. So I'm just going to turn to my other screen here with the pointer, because I've got a few things up on the screen here. So we could extract from the leaves when it's the herbs and herbaceous plants. It could come from the seeds or the buds, as in clove bud. We've got some lovely juniper berry here, but it could also come from the petals and flowers, the grass, the root like ginger. It could come from the wood, like the heart of the wood in sandalwood, or the bark of the tree, as in cinnamon bark. It can even come from the resin. I've got some frankincense resin in the bottom right of the screen, and also from citrus. So you'll know yourselves, you'll have experienced it yourself. In citrus, the essential oil, or those volatile organic constituents, reside in the rind of the citrus fruit. So when you zest a lemon or peel an orange, and that zingy, zesty smell, you know, really uplifts and hits you quickly in the face, that's the beautiful volatile organic constituents. Now, when I say volatile, I don't mean that they're angry constituents. They are, they easily evaporate into the atmosphere. Okay, so citrus is slightly different to most of the other plants when it comes to extracting, because we don't tend to use heat processes with citrus. It's a cold expression, but for the most part we use steam distillation, and there are other extraction techniques, but today we'll talk about steam distillation. Now, had I been there in Christchurch with you all, I would have brought down my still so that you could have had a look. This is one of my copper steam distillation units. I probably wouldn't have got this one through in a suitcase. I would have brought the smaller one, but it does give you a bit of an idea about the process. So we need to create steam. So obviously we need water and a heat source. So the water goes in this onion bowl at the bottom here, and underneath it I usually have an electric element. But in my travels around the world to see distributors and growers where I buy my essential oil products, I've seen everything from gas to wood fires to press button and steam jets. So there's all sorts of things that can happen. And the process, whether it's a home unit like this one or a commercial unit, the process is still exactly the same. So we put the water in the bottom here to create the steam, and before we get it all set up, we fill this central column with the plant material, packing it down. And what you can't see is that at the base here, inside, at the base of that column, is a copper plate with lots of holes in it, so that it stops the plant material from dropping into the water and allows the steam to penetrate up through that plant material and carry with it those volatile organic constituents. So the steam will open up the vesicles, all of those VOCs will come down through the copper piping, as you can see here, and then under the surface of the water, that copper piping forms a coil shape, and this is called the condensing coil, this part of the unit here. So the cold water pours in here, and I usually have a circulatory system where the cold water is then cooling the outside of that copper coil. The steam is on the inside, and once it hits that cold copper coil, it will then condense back to a liquid, and that's known as a distillate. So here we have the distillate pouring off the, this is a commercial still in the Lavender Distillery in Berriedale in New South Wales. And at this point, the essential oil is sort of mixing with the water, and we need to separate it off. So on the right side, you can see we've got this lovely squid apparatus. It's a separating glassware that we can then allow that distillate over time to separate and just allow nature to do its course, because oil, as we all know, is lighter in density than water and will float to the surface. So we've got this thick band of essential oil here, and then we've got this cloudy, watery solution underneath, which is called the hydrosol. Hydro meaning water, sol meaning solution. And if we followed that squid apparatus down to the bottom, there's a little tap, and then we can drain off that hydrosol and then decant all our essential oils into the little bottles. Now, when it reaches this point, an essential oil is almost a 100% concentrate of chemical constituents, so highly, highly concentrated. Just before I leave this slide, I just want to mention about the hydrosol, because that was always thought of as the byproduct of steam distillation until it was discovered there were actually water-soluble chemistry that passes over through that steam distillation. It's about a 1% dilution, so very, very mild. I use a lot of hydrosol in my own work, and it's now considered the co-product of steam distillation. So I'll talk about hydrosol a little later on in the talk. Now, we've known for many centuries about the therapeutic effects of an essential oil, but it's been in the last 100 years that chemists have identified the specific chemical components that will have actions on the body. To make it easier for us, because there are hundreds of chemical components, the chemists have grouped them into chemical families. There's about 7 or 8 chemical families that we're interested in, and each chemical family, depending on what's in it, will generally have some therapeutic action on the body, such as antimicrobial, or it might be anti-inflammatory, or it might be calming and sedating. And an essential oil will have something from each of those chemical families. In general, it will really have a little proportion of each, but it depends on what those proportions are as to what that oil's therapeutic properties are. So just to explain that more simply, on the screen, we've got on the left-hand side, Melaleuca alternifolia, Australian tea tree, widely known for being very antiseptic, antimicrobial, antifungal. And on this very simple pie chart, I've just put in the main chemical families, the monoterpenes, but also this huge proportion, 47% of monoterpene alcohols. And of that, about 30% is terpenophorol. And that really gives tea tree that medicinal odor, as well as those antibacterial, antifungal, antimicrobial properties. Now, on the other side of the screen, excuse me, we've got the lovely Anthemis nobilis, Roman chamomile, those daisy-like little flowers that we can dry. We can steep them in hot water, and we can have a little tea, which will help settle the body at night. Mainly, it will help for sleep and calm the body. Now, if we just compare the monoterpenols, tiny proportion, 5.5%, hardly anything, very mildly antimicrobial. But look at this huge proportion, this domination of the chemical family of esters. And generally speaking, esters, particularly in Roman chamomile, are very calming to the central nervous system, very soothing and balancing to the body, but also very anti-inflammatory. So it does depend on the ratios of those chemical components as to what an essential oil's primary therapeutic properties are. When we come to use essential oils on the body, we do so in two tried and tested ways. One's through dermal absorption through the skin, and the other is through inhalation. So we're just going to touch on those briefly. Now, we generally don't apply essential oils neat to the skin. Two reasons. One is that some of those chemical families, the phenols that we see in cinnamon and clove, the aldehydes that we see in things like lemongrass, mei chang, or melissa, lemon balm, they can be very irritating, those particular chemicals, if they're placed neat on the skin. And so we generally don't apply essential oils neat to the skin. And the other reason is if an oil has been oxidized, if it hasn't been stored properly. So heat, light, and oxygen will degrade an oil, and will do it very, very quickly, but particularly oxygen. And I see a lot of it when I see people at counters looking at essential oils, and the lids are off the essential oils. And because they're so volatile, because they evaporate so easily, all the aroma is going out into the atmosphere and all the oxygen is getting in. And that will change the chemical structure of that essential oil. And an oxidized essential oil, if it's used on the skin, will cause skin sensitization. And that sometimes there's no going back from that. So to get over these things, we first of all, use oils that are fresh, that they've been well stored, and that are ideally organic, because we don't want the pesticides and herbicides which will transfer over through distillation processes and extraction processes. We also want to be able to dilute the essential oil. So as I said, when we see it at this point, it's at almost a 100% concentrate, and we need to dilute that down to make it a safe passage into the body. And we do that by mixing it with a fixed oil, something like a vegetable oil like grapeseed, or a nut oil like sweet almond or macadamia oil. And we can make that dilution and take it right down to about 1 or 2%. Generally, a healthy adult is about 2%, but in my line of work, I may use 1% or even less. Then we can apply that to the skin. And because essential oils are so lipophilic, very fat loving, they will be carried easily by the carrier oil in through those skin layers, and the essential oil will absorb very readily through those dermal layers. Now, the other route is aromatherapy, inhalation, and this is very direct, it's very potent, and for me, I find that it's one of the most powerful ways that we can be using aromatherapy, because it uses our sense of smell. Of course, when we breathe anything in, a part of it will go onto our respiratory system, and those essential oils, because they're so lipophilic, they will pass easily across the mucosal lining of the lung tissue and into the general circulation. But what we're interested in here is this sense of smell, our olfactory system. And when we breathe those aromatic molecules in, they will attach on to the receptors of the olfactory nerve. And those receptors reside just at the back of the bridge of our nose. And the olfactory nerve will then transmit that information straight to the limbic system. So the limbic system sits deep within the brain. It's a small structure, but it's commonly known as the emotional center because it houses some power pack structures in there. So it things like the amygdala. So that's an area that deals with our emotions, our fears, our panic, our anxiety, our anger. It also has the hypothalamus, which deals with our whole stress axis and all of those stress hormones. That's within the limbic system, and also the hippocampus. So the hippocampus, one of its roles is to create, store, and retrieve aromatic memory. So when we breathe in an aroma for the first time, hippocampus, and this is a simple explanation, a hippocampus will take a sensory snapshot of everything that we're experiencing at the time. So everything we're seeing, hearing, tasting, touching, all of those things will be stored. And when we come across that aroma, whether it's in a few weeks' time or 50 years later, hippocampus will retrieve that aroma, and we can experience sensorially almost as powerfully as we did the first time we ever smelt it. So a lot of those situations will take you back to childhood. It's very often I hear people smell an aroma and they'll say, oh, that reminds me of. And very often it takes you back to childhood, because as children, we're curious little folk. We're tasting things, smelling things, sticking things in different orifices. And hippocampus is busy at that time creating all of this memory bank of smell for us. But so very often these smells can take us back to something that's beautiful and gives you warm, fuzzy memories. But there is a word of caution here, because especially when people listen to aromatherapy talks, or they've read a book, or they've got, on that aromatherapy pathway, they want to share it with everybody, which is totally understandable. But what may be a beautiful aroma for one person and may give them warm, fuzzy connections and memories could be somebody else's nemesis. It could be completely different experience, and I've come across that even within families, even in your little bubbles. Just be very mindful if you are using aromatherapy that it's not that it's engaging with you, but it's also engaging with everybody else in the same way. So when we come to use aromatherapy within healthcare, traditionally, the dermal route's been used via aromatherapy massage. So diluting those oils right down to about 1 or 2%, and then applying them with beautiful slow stroke massage. It's not about getting into knots and getting elbows and fists in. It's literally about slow stroke, skillful massage. So it's taking that busyness of the central nervous system, that sympathetic activity, it's settling that right down and placing somebody in that beautiful space of parasympathetic activity where it's a beautiful space of calm and peacefulness. Aromatherapy inhalation has traditionally been used with little burners to create an ambiance, or aroma stones, or a cold air diffuser. And all of this comes under the umbrella of holistic aromatherapy. And as holistic aromatherapists, we're interested in not just the physical part of a person, we're interested in the whole. So we're looking at them from a physical point of view, how that's affecting them emotionally, socially, and spiritually, with the aim of taking somebody into a deep level relaxation of mind, body, spirit. There's a lot of research that's been done, particularly when I was working at the Marsden. They were generating a lot of research looking at aromatherapy, massaging, and inhalation for relaxation purposes. And holistic aromatherapy really formed the cornerstone of aromatherapy intervention in healthcare for many, many years, until about 2011, and we started to see the evolution of clinical aromatherapy. Now, as a clinical aromatherapist, we're interested in those chemical families and how we can target them to somebody's specific symptoms. It does require advanced training of appropriately qualified aromatherapists. I undertook my training with Rhiannon Lewis in France. She's a leading authority in clinical aromatherapy. And as we sit here in lockdown, I just really feel how blessed I am to have even made it that far. So So clinical aromatherapy really started to evolve, and we started to see it being integrated into healthcare. And Marianne Tavares, who is a very recognized person in the aromatherapy world, she's a complementary therapist and a registered nurse. She published some guidelines back in 2011, which looked at wound, skin and mouth care and some of those early approaches of clinical intervention, and how we could integrate that. Now, the key word on the slide is integrating, because I hear a lot of people say, oh, it's alternative, and it isn't. Alternative practice is when we turn away from conventional medicine and follow just purely a natural route. Where we're using integrating aromatherapy, we're working with our medical colleagues and nurses and healthcare professionals, and the conventional medical approaches, we're working together with them so we can work safely. So Marianne looked at, from a point of view of wound care, she was using lavender and tea tree, antimicrobial marriage, it still is. But when I was at the Marsden a couple of years back at that seminar, I met Dr. Jackie Stringer, who leads the complementary therapies team at the Christie Cancer Hospital in Manchester in the UK. I met some of her tissue viability team and a professor of microbiology, biology, Dr. Valerie Edwards-Jones, and they were making huge strides using essential oils with wounds that weren't healing and that were showing a lot of resistance to antibiotic therapies. And of course, now we've got this antibiotic apocalypse. We're looking to other things, and essential oils really are showing an immense amount of promise there, and particularly with things like malignant wounds, which may produce a lot of exudate or malodor, and essential oils are being extremely effective, being used directly on those wound beds. In terms of skincare, we've got a whole range of essential oils that we can use for various skin situations, but also an equal amount, I would say, of other botanical products that probably don't take quite so much center stage. Things like calendula oil, which is macerated from the beautiful marigold heads. It's a lovely deep orange, sort of ochre color oil. Very anti-inflammatory, very soothing for things like sunburn, which you may recognize it for. In my line of work, I may use it as to moisturize skin, particularly if skin's very dry or if somebody has something like itch. But also I would be using it for any skin that's been damaged from radiotherapy treatment. We've also got things like cocoa butter, which is a great skin softener. It's very chocolatey, so I particularly connect well with it. It's great for lip balm, so we can use it as a lip balm, particularly if there's sores or cracks or fissures in the lips. And there's things like aloe vera gel, so things that you may already have come across yourself. And aloe vera gel is beautifully cooling, anti-inflammatory. When it's applied to the skin, it's non-greasy because it absorbs quickly. And those, I would be using things like aloe vera gel for things like restless leg syndrome, chemotherapy-induced peripheral neuropathy, which I will be talking about just shortly. When it comes to mouth care, that's where the hydrosol comes into play, that co-product of aromatic distillation. Because we can use hydrosol as a mouth rinse, and it's much gentler and kinder to the mouth, to somebody with a sore mouth, particularly after having chemotherapy treatments or radiation treatments, than the over-the-counter products, which can be very stringent. So we can mix essential oils into hydrosol, mix it with honey, and then that can be sort of swished in the mouth for about a minute and then spit out, and those essential oils then will diffuse easily across those mucous membranes of the oral cavity. And we can also freeze hydrosol, so we can make ice chips or popsicles out of it, which is really comforting for somebody with dry mouth syndrome. Or we could always simply use it as a spray directly into the mouth. So since Marianne led the way back in 2011, aromatherapy really has advanced to incorporate a lot of other symptoms. So I've listed a few here. It's not all of them, and I could wax lyrical all afternoon on all of these, but I'm seeing the time ticking away here, so I'm going to just choose two, and the one I'm going to talk about first of all is spiritual distress, because I want to showcase aromatic inhalation. The second one I'll choose is complex pain, where we can look at a combination approach. And spiritual distress is an important area, certainly for me, because spirituality is integral to all of us. It's what determines our quality of life, and it's what we lean into in times of adversity. Now, I write for the International Journal of Clinical Aromatherapy, as Deborah mentioned at the beginning, and one of my first papers was about spiritual care. And it was really disturbing to hear, because I work from, I like to hear the patient's perspective, and for me that's so important. And hearing that patients felt that their spiritual aspects of their care were really being neglected, and that was even as recently as 2018. So it is quite disturbing that it's an area that health professionals maybe just don't have the time, or it's a difficult conversation to open up. I'm not sure, but let's help them with that with using aromatherapy, I think. So I'd like to just look at the psychological manifestations of spiritual distress, just because of time limits today. And on the screen, you can see these are the most commonly reported emotional issues that are raised as part of spiritual distress by patients themselves. And they report that they're much worse at night. Very often, when that negative thought drops in, suddenly it starts to escalate and suddenly snowball, and then we've got insomnia happening. So the treatment of anxiety and insomnia have been central domains of aromatherapy intervention for many, many decades, using holistic aromatherapy approaches. And a lot of that research showed that we could reduce anxiety, we can reduce depression, we can help somebody relax and sleep better, just like I saw for myself back at the Marsden over 30 years ago. But since the evolution of clinical aromatherapy approaches, we are probably more concentrating now on the inhalation route. So I'm just going to introduce you to the aromatherapy inhaler stick, which was first introduced to the UK oncology centres and palliative care units back in 2004, and it represents one of the biggest changes in aromatherapy intervention that it's brought to patients. Now on the screen, it's looking absolutely huge, so I'm going to try and bring it closer to the camera so that you can see the size of it compared to my little finger. It's only the size of my little finger. It doesn't go right up the nose, it sits around the edge of the nose. So looking at the screen here, we've got this white wick, and when I'm working with somebody, I'll be listening to what that person has to say, and I'm listening for what it is that's concerning them the most, what's worrying them, what's keeping them awake at night. And so we'll do a consultation around that. And I'll be selecting a few essential oils, maybe 5 or 6 different essential oils that I know could help in those situations. And then I'd invite that person to choose 2 or 3 oils that we can then blend and then load into this central wick. This lives then inside this central chamber, and you can see at the top here, there's some little air vents. I'll just bring one close to the camera so that you can see those little air vents, and that just allows for evaporation of the essential oil components. And the nozzle cap, you can just put straight back on. That will hold the device together, but will also minimize essential oil evaporation. when it's not in use. So all a person has to be instructed to do is, when they're ready to use it, is to take off the nozzle cap. They place those two air vents close to the nose. So it might be close, it might be a little further away, depending on somebody's sense of smell, how good it is on the day. And then they're just instructed to take a breath in through the nose and blow it out through the mouth. And then they repeat that nice and slowly if they can, and out through the mouth. Repeat that between 4 and 6 times, then put the nozzle cap back on. So if somebody's using this very regularly, as a lot of my clients tend to, as long as they're putting the nozzle cap back on and minimizing essential oil evaporation, then this has a therapeutic lifespan of about 2 months. But if I'm working with somebody with emotional distress, spiritual distress, somebody yesterday, I remember, put a question in about post-traumatic stress disorder, then I would be using this in a session of aromatic anchoring. And that's when we would make up choose the oils, make up the aroma stick. But before that person came to use it, we would take that person into a place of relaxation, of deep level relaxation. So that could be through a beautiful aromatherapy massage. It could be through hypnosis. Some of my colleagues have worked with these sticks with hypnosis, and some use it, and I use it too, for visualization techniques. Once that person is in that deep level of relaxation, that's when we would first introduce the aroma stick and get them to breathe in through the nose, blow it out through the mouth between 4 and 6 times. Hippocampus then takes the sensory snapshot of everything that's happening for that person. We'll store that information. That person then leaves the clinic. They've got instructions to use this whenever they feel their anxiety or their fear or the panic or insomnia coming on, whatever those issues are. And they're instructed just to take themselves to a quiet place, close their eyes, unscrew the cap and breathe. Breathe it in through the nose, blow it out through the mouth 4 to 6 times. Hippocampus then takes them back to the warm place where they first met this aroma, they first smelled it. So it could be the warmth and safety and beauty of that aromatherapy massage, or it could be the lovely forest walk they took in their visualization. It's very, very powerful. And if I'm working with somebody with aromatic anchoring, I would do it over about 3 consecutive sessions using the same oil blend to really anchor that memory in with the stick. But very, very powerful. We can use these for other symptoms: nausea and vomiting, breathlessness, mental fatigue, particularly chemotherapy-induced mental fatigue. I had a client recently who's a GP actually going through chemotherapy treatment, very cautious about aromatherapy, wasn't sure about it, wondered what it could do. And they actually started experiencing that veil, he called it a curtain coming down of mental fatigue. So we worked on an aromatherapy stick and used some of the citrus oils because they're very uplifting and zingy and zesty. And he was so surprised at how quickly that veil actually lifted. And so he clutched his stick and off he went home. So very, very useful thing to have in the kit bag. The other area that I said I was going to look at was complex pain syndromes. And the one I want to talk about today is chemotherapy-induced peripheral neuropathy, because it is a common and debilitating and distressing symptom for a lot of patients undergoing chemotherapy treatments. It affects the sensory nerves of the peripheral nervous system, and it's a complication of some chemotherapy agents. It depends on the drugs that are being used. the dose of the drug, total dose of the drug over time, and if there's any underlying medical history as well, as to whether somebody would actually experience these symptoms. So it affects the sensory nerves of the peripheral nervous system, so mainly the hands and the feet. The central nervous system, our brain and spinal cord, are well protected from chemotherapy agents. There's some sort of natural barriers in place. But once those nerves leave through the spinal vertebrae and out into the periphery, then they're much more vulnerable to the toxic effects of chemotherapy agents. And the chemotherapy will damage the protective coating, the myelin sheath of those nerve fibers. So as I said, it affects, if it's going to affect anything, it'll be the hands or the feet or both, and it'll be both hands, both feet, or hands and feet. And it will start at the tips of the fingertips, and it can work its way up the forearm or the tips of the feet and work its way up the legs, that change of sensation. But peripheral nerves do have the capacity to repair themselves. So once treatment finishes, then the body's natural processes will take over to try and repair all of that myelin sheath and restore full function again. In most people, that will happen. But the symptoms are the classic symptoms of neuropathic pain. So that lancinating, burning, pins and needles type of sensation. There can be alteration to sensitivity, to heat, to cold, to pressure. So I've seen people, saw a patient a few years back who, when they were typing, it felt like ice shards through their fingertips. People who can't put their shoes on easily, who find difficulty where they're planting their feet, where they're actually positioning them. And that can then cause imbalance and somebody to topple over and other injuries. And it also causes a loss of dexterity. So those fine movements like sewing or writing or even texting can be quite difficult. If I was working with somebody from an aromatic perspective, then I would be looking at a two-pronged approach. We can't underestimate the psychological impact that CIPN can have on a person, the distress that it can cause. So the first thing I would be considering with a person would be the aromatherapy inhaler stick, because then we could use essential oils that would deeply relax the central nervous system, and I would be using that aromatic anchoring, because it would work well to really strengthen a person's coping abilities, to uplift their mood, and consequently that then helps to reduce the perception of intensity of pain. But I'd also combine the stick with a physical application. So I'd be looking at using that aloe vera gel and combining essential oils into that, and looking at essential oils with analgesic or pain relieving properties, local anesthetic properties, even cooling properties. And some of the examples I've got up on the screen here, we've got spike lavender, which has got a high analgesic level in it. Ply, which is a Thai ginger, which is a quite cooling as well as being very analgesic, quite different to the normal ginger root that we usually associate with being quite warming. And also look at possibly corn mint or something like peppermint, where we can where it has the high level of menthol, and menthol will interrupt those sensory nerve pathways back to the brain to say, look, this is more of a cooling experience that's happening rather than a painful one. So I would mix that gel, and the person would be instructed to apply it. So if it's the hands, it would be both hands through the hands, the fingertips, and extend up to where they experience any of those sensory changes. Similarly with the feet, but also to the corresponding area of the spine. So if it's the hands, it would be the nape of the neck, the cervical spine. If it's the feet, then it would be the lumbar spine, the lower back. And if it's both, then it would be both areas of the spine. And that really gives us a double whammy that when those sensory information goes back and is interpreted by the brain. It's telling the brain it's much more pain relieving and a much more of a cooling experience than it is of a painful one. So that was a bit of a whistle-stop tour there of aromatherapy, how we can use it, how we can use a range of essential oils and hydrosols and botanical products in a variety of ways. It's not just for patients though. You know, you've got whānau, caregivers, staff, everyone that's involved as your support team and support network really could be benefiting from having some self-care and support too. And from referral onwards, and even after, you know, curative treatments have happened, I listened into Jake Bailey's talk this morning, and he was saying it took over a year for him to really feel that his mental health was in a much stronger place. So it can be utilized as and when it's needed. So it just leaves me to thank you all very much for listening and tuning in, which has been lovely. If any of you do have any questions, I think we're probably going to have time, but you feel free to email me if you want to. It's my best medium that I work on. And if any of you want to read the papers that I've written, I've got a few of them on my website that's listed there, or just say a little hello on Facebook on the business page if you want to. So it just leaves me now to, I think, just end this. I think I'll stop the share, which means I can come back. Here we go. And
thank you, Carol.
Okay. Hello.
Hello. That was absolutely awesome. Thank you very much for that. So intriguing and such a beautiful presentation as well.
Oh, you're welcome. Thank you.
It must be lovely working with all the you know, the base ingredients for your essential oils, all the flowers and herbs.
It is. It's a beautiful medium, and there's so much love that goes into it. You know, when a person comes to a clinical room, it's not like going to a sort of a hospital clinical room where it is very medicinal. We can bring in flowers, we can bring in all those beautiful touches, different textures of fabrics, warmth, making sure the table's warmed, the towels are warmed, all of those things, which all of that collectively gives such a beautiful experience for somebody.
So very nurturing when times are really quite difficult for people.
Yeah.
We don't have any questions. I'm sure you've given people so much to think about that they'll need time to mull it over. They have your email address, and I'm sure you'll probably be inundated. And I especially love those the aromatherapy inhaler sticks. I thought they were a fabulous innovation.
Oh, they're fantastic because we can use them for so many different things, and they're you know, they're relatively inexpensive in comparison to all the other drugs that are being used.
In relation to chemotherapy, they're probably a drop in the ocean cost-wise.
Yeah, and also it gives somebody a sense of control. You know, they can then control what they're doing. They can, and it's something that it's not a drug that may alter their awareness or make them feel drowsy or tired. It's something that is just can be refreshing or supportive, and they have control of that stick. So it can be very empowering.
Yeah, oh, that's fantastic. But again, on behalf of LBC and all our patients and everybody that's rung in today, I would really like to say thank you, and thank you for your time on this lovely sunny Saturday for doing a presentation. Oh, we've just got quickly one question. Where do you offer your workshops, Carol?
Oh, right. Well, I've just had to cancel a whole load because obviously of lockdown. I can't work with anything with until we're in level 1. But I offer my workshops throughout New Zealand. Mainly it's been sort of Auckland, Kerry, far north. I've done sort of Hamilton, but I haven't done the South Island. So it's always would be lovely to come and do a workshop in the South Island. I'd really enjoy that. So yeah, if you make a contact with me and then work from there, but I've had to, and I've got 2 lined up that are fully booked in October and November up here in the far north, but it's increasingly looking like we'll have to cancel those until we're in level 1, but fingers crossed.
We'll get there. We'll get there.
We'll
But
get there.
again, thank you so much for your time and a lovely presentation. Well done. Thank you.
Oh, thank you. I just want to say thank you to all of you, because you've been immensely supportive. You know, you, Sheldon, Emma, Matt, it's been a fantastic, you've really supported my work for many years. So I'm immensely grateful, and keep safe, everybody. Go well.
Absolutely. Goodbye, everyone. Bye.